So again, it depends on the stages of the prostate cancer, as would be the case with any cancer as well. So let's look at the prostate cancer. We tend to use the word saying that there are more people who die with it rather than because of it. In that, when I'm saying that 70% of 70-year-olds will have prostate cancer, all of us know 70% of 70-year-olds are not dying of prostate cancer. So prostate cancer is very prevalent, but it isn't a cause for the shortened lifespan. So the first definition that we tend to do is this a lethal cancer or not? Or what we tend to say is, what is the risk? The risk of this prostate cancer shortening the lifespan of the patient as well as the lifestyle of the patient. So we use few characteristics of the cancer to determine, is this a low risk, intermediate risk, high risk, or very high risk. We use PSA, we use the Gleason score. Gleason score is how aggressive the cancer is. And then we tend to use the clinical stage, which is by examination and MRI scan, and then put them into this category of low risk, intermediate risk, high risk, very high risk. And normally for low risk, we can just keep an eye on the cancer, because even if we treat them, even if we don't treat them, the chance that they will die of that prostate cancer is 1 to 2% over 10 years. We can say that by treating them, we are curing them, but even if you don't treat them, they are fine. So low risk patients, generally we keep an eye. Especially the more elderly they are, the less is the chance that they should be subjected to any treatment. Intermediate risk, if they are young. Young is categorized in oncological terms as anybody under 65 is young, anybody over 65 is, we tend to say that they are old. Does depend with respect to their, if somebody has got a cardiac history, diabetes and everything, then even a 60-year-old probably is physiologically 70-year-old. So taking everything else away, age group wise, we tend to say under 65 and above 65. So intermediate risk, under 65, we try to cure them of the cancer. Above 65, we can say, does this patient need curing or not? Or there are other reasons why his lifespan might be short. And high risk and very high risk, almost we tend to treat with the objective to cure in almost all the patients. What are the modalities? The modalities are generally two ways. Either you take it out, which is removal of the prostate, or you cook it, in that you heat up the prostate, whether you use radiotherapy standard or proton radiotherapy, or you use any focal radiotherapy, which might be either high intensity focused ultrasound scan or any of them. To cook, you heat up the prostate cancer so that the cancer cells die.